Hi, I'm Gerald Weeks, and to my right is Dr. Hertlein.
Hi.
And we are doing this at the request of your professor, Dr. Openshaw. So this is going to be very informal. We don't have a script. This is all completely unrehearsed. We just wanted to say hello to all of you, and we're delighted that you're using one or both of our books this semester. We do have two books out that are fairly recent, and we suspect you're using these. The blue book is the Systemic Sex Therapy book, and these are really companion books. The first book is a comprehensive overview of all the major sexual dysfunctions and includes etiology and treatment strategies and some general information, and a chapter on the proper use of sensate focus, which is, I think, really unique in the literature. And then we wrote a second book, and the first book, we essentially wrote half of that book, and then we had other folks write chapters for the other half. The second book we did was with Sendak, who's not here. She was a student in our program, a PhD student. And we really wrote this for beginning sex therapists and students. It gives you various treatment plans. We tried to break it down, keep it as simple as we could, give you treatment decision trees, or what we call algorithms, so that you'd know how to sequence your treatment and keep it as practical as possible. The books are really based on two fundamental ideas. The first is that we wanted to produce something that was systemic in nature, and certainly by now you're all familiar with systemic thinking, so I don't need to talk to you about systemic thinking, but historically sex therapy has been behaviorally oriented and individually oriented, going back to Masters and Johnson. And then as you move through subsequent additions to Kaplan's book, The New Sex Therapy, you saw a combination of psychoanalytic / psychodynamic psychotherapy combined with behaviorally oriented treatment, or the old Masters and Johnson approach with basically a psychoanalytic overlay. And then as you move up to the Principles and Practices books, I should say, you see more behavioral literature, and as time went on to the last iteration of that book, you see that it's become much more medically oriented than in past years. So I think the edition prior to the last edition is their best behavioral edition and best edition as far as psychotherapy from a behavioral perspective goes. Our book is also based on a model that I've been working on for many, many years called the intersystems approach. And that's a comprehensive approach that allows us to systematically integrate individual factors and problems, interactional factors, and intergenerational factors. So when we think about a sexual difficulty, we want to look at it in terms of what kinds of individual factors might be contributing to the problem, and that includes medical factors, the types of interactional factors or dyadic factors, namely the couple's relationship, which, by the way, gets back to a book that I wrote many years ago called Integrating Sex and Marital Therapy, and that was the first book of its kind to talk about the integration of those two fields. And then some intergenerational factors. You see this in certain problems, especially, for example, in the treatment of hypoactive sexual desire. And then once you've examined the etiology of the problem from those three perspectives, plus look at broader contextual factors, societal and cultural factors, and you put all those pieces together, then you can begin to develop a treatment plan that integrates the treatment of all those various causal factors. So it's not a simple model to learn. In fact, it's a very complicated model to learn because it requires that you have a good understanding of individual psychotherapy, couple therapy, and family therapy, and multiple theories within each of those fundamental modalities. So I wish you well in your course, and I'll see if Dr. Hertlein has a few comments to add.
I have a few comments. Hi, I'm Kat Hertlein, and I was very happy to be a part of these book projects, or this book project, these books. There were two of them.
Two.
They started as one, they evolved into two. And what I want to say about, I guess, the development of these two books was that we really just got the sense from the field of family therapy that the sex therapy courses were taught with the Principles and Practices book, with the Case Studies in Sex Therapy book, and then a host of other articles. And we really wanted to get away from this kind of piecemeal approach to teaching this course. So we thought we'd have all of the information that an MFT student would need put into these books. And that's how they evolved in kind of this two process. This first book that talks about theory is really good for students because in addition to walking you through each of the disorders or dysfunctions or problems within the intersystems approach, we also provide kind of a case example of when that problem occurred and how to treat it through the intersystems lens. So while Gerald said that these are pretty difficult concepts and a pretty difficult technique to really master, I think we do a great job of helping the student understand how to master it and what pieces are in place just by the way that we chose to structure the book. The second thing that I want to talk to you about is the type of people that we had involved in this project. With the edited book, we had people who are very well known in the field of sex therapy willing to contribute, thinking this book was a great idea. So in addition to the dysfunction chapters, we have chapters on what it means to be a sex therapist and talks to you a little bit about the history of that. We have information on just the basic anatomy and physiology so that students really can get all of that information within this book. What I'll tell you about the second book is we really got a lot of questions from students about how to actually practice sex therapy. Certainly you can't wait until you are an expert in all of these modalities and approaches to even attempt to do sex therapy. I know we have some of our own students here who have sex therapy cases in the clinic and need to know what to do today, right this minute. And that's where actually the second book, The Clinician's Guide, comes in handy. Because here we actually walk you through how to triage treatment, how to do an assessment, how to prioritize what you're going to do. We have a case formulation sheet. We have resources, websites that you can go to. So it's just a real hands-on piece, and it's really what the clinician needs when they are walking into the therapy room and dealing with these cases. And I think that's why the pair of them together makes such a strong, I guess, book section or book.
Well, it's as I see it, it's
strong.
the two volumes, they're companion books. Basically give you everything we think you need as a sex therapist. And of course, we didn't include the medical information because that's been discussed so much in the Principles and Practices book. So you can always pick that up from the Principles and Practices book. And we didn't emphasize the behavioral that much, but that's because you can always pick that up from the Principles and Practices book. So
we really wanted to make it systemic.
we wanted to make this systemic, and we wanted to keep it as practical as possible.
We also know that in general, you know, couples therapists are not trained to be very good sex therapists per se. We also know that sex therapists are not trained to be good couples therapists necessarily. And to really be good at sex therapy, you have to be both. You
Right.
have to have an understanding of individual, biological, psychological, couple dynamics, family and society dynamics. And I think these two volumes give you that. So that was our impetus for beginning this project. Anything else you'd like to add?
Just one final thought. When you're done with your course, we would certainly appreciate your feedback about the information that you got from these volumes.
Absolutely.
So that when we get ready to revise this in a few years, we'll have some feedback and we can improve it at that stage.
Absolutely.
So,
Thank you.
Thank you and good luck.